All right, next up we have Katie. Katie is a post-surgical patient, so take it away.
Thank you, Patty. Good afternoon. My name is Katie Gillick, and I'm from Connecticut. I'm a state ambassador with the National Organization for Rare Disorders, and I support the Hypoparathyroidism Association with various advocacy campaigns. I knew someday that I would be before you. I have been writing these words with my actions for over 5 years. In fact, 5 years ago today, I was in the hospital with a calcium crash. 4 years ago this month, I met the doctor who saved me. 3 years ago this June, I screened into a phase 3 clinical trial. 2 years ago this July, I met my boyfriend, who is here with me today, for a moment I thought I would be experiencing alone. On June 1st, 2018, World Hypoparathyroidism Day, I was diagnosed with papillary thyroid carcinoma. A partial thyroidectomy led way to a completion surgery when microscopic tumor spread provided concern for infiltration to the other half of the gland. Final pathology revealed that there was no spread. This was the surgery that caused my hypopara. I had no thyroid and damaged parathyroid function. In terms of organ loss, I had gotten 2 for the price of 1. I began to adjust to a life without a thyroid and fully functioning parathyroids simultaneously. That burden is vastly underestimated. At 24 years old, my life consisted of labs, 24-hour urine tests, ER visits, and going to the pharmacy multiple times per week. My cognitive function, energy levels, and kidney function suffered. My inability to retain and process information became a source of immense frustration. I was angry, sad, and scared, and I couldn't be. I was trapped in a body that could not stand to process the trauma that I had lived through because the stress of reacting emotionally was adverse to my condition. Standard of care treatment was not only not helping me, it was harming me. I visited a doctor who was an expert in this condition, and knowing the disease burden and the limitations of treatment options at the time, he told me to limp along until better options became available. Limping was not going to work for me. I worked full-time and came home at night to research my disease and to try to find solutions that would save me. I visited my treating hospitals, medical library to read the literature and to try to unearth my own cure. I created my own patient and medication summaries to give to my care team. I even applied to a career changer pre-med program, believing that I was the only person who could save myself from this disease. Then I met a doctor who said, "We're not going to leave you like this." I was accepted into a clinical trial. Within 1 month, I came off of all of my calcium, vitamin D, and magnesium. I no longer visit the pharmacy multiple times per week. I can carry on a conversation without trailing off mid-sentence, and I can access the words that I want to say. I can go to the store without a list and remember what I'm going for, where it is in the store, and how to get to the store in the first place. I work full-time, travel, and have a social life and a relationship. I get angry and sad and frustrated and scared and sick, and I withstand it. I play tournament softball in the heat of summer. I am a paralegal, and I have assisted 3 federal trials. I walk down the street in a dress and heels, carrying a backpack with 2 laptops and 6 water bottles, while rolling a briefcase behind me and carrying a stuffed file folder in one arm. I have morphed back into the woman that I once was. Diabetes without insulin. That is hypopara without parathyroid hormone. I attribute my success to early intervention. I had hypopara for 2.5 years by the time I entered my clinical trial. My kidney function has been 100% restored. My bone turnover is normal. My calcium levels are stable. My brain fog is gone. It is not perfect all the time. I still get symptoms when my body has had enough. But my capacity to tackle life's challenges has vastly expanded. Symptoms are now a cause for alarm rather than a daily burden. My quality of life has returned because of quality treatment. I have gone from having my medical issues be the center of my life to having them be a facet. That is the difference that good treatment makes. HypoPARA no longer has the power or the control. I do. I am so grateful. I dreamed of the day when my doctor and I would stand side by side to share our story, the one we lived together, to advocate as the voices that joined in unison in support of a better life for our patient community and for me. Today, that dream is realized. My doctor and my drug have helped me to create what my disease had begun to destroy: choice. I have these choices now because my disease is not choosing for me. I have reclaimed the freedom that I had lost. The drug I am on is Transcon PTH. The doctor who saved me is Dr. Michaela Rubin. We did it. Me and my doctor and my drug. One of the most precious things you can give a patient is to be heard, understood, and believed. Thank you for giving me that gift today by listening to my story.
Powerful words spoken, Katie. Thank you so much.